Hi, everyone. Bill Rentschler in the 1011 Now streaming studio, joining you today with a unique segment, something that we really don't get to do as often as we'd like to do, but really kind of doing an in-depth interview and deep dive into issues that affect the community. And today we're going to be talking sort of about some mental health issues. And joining us today, and really grateful for him to be joining us, is Dr. Daniel Fick, the Chief Medical Officer with Hy-Vee. Dr. Fick, thank you so much for taking the time to join us today. We really appreciate your time.
Oh, you're welcome. It's my pleasure to be here.
And so, Dr. Fick, one of the first things I'd like to ask you, because when I think of Hy-Vee, I'm thinking of my Asiago cheese bagels and going and getting my groceries and things like that. I had no idea that Hy-Vee had a chief medical officer. Can you kind of give us a little bit about your background, how you came into this position, and what this position kind of offers the people in local communities across the Midwest?
Sure. So I've been with Hy-Vee as the Chief Medical Officer coming up on 3 years. So I am a long time and still currently a faculty member at the University of Iowa in family medicine. Lots of different jobs over the years, in addition to taking care of patients. And one of them was an executive physical program. So I knew most of the Hy-Vee executives. They would all come on over to Iowa City, and I would see them there. And kind of in between the early parts of the COVID pandemic, the CEO, Randy Edeker, who I'd known for 10 years, said, they wanted a chief medical officer to help them work with some initiatives and the pandemic. And, as a point in my career was I would either take it or end up staying at the university. And so we just made a jump sort of faith and started with Hy-Vee. So interestingly, I'm considered a rehire because I sacked groceries in the 70s. So when people ask me when I was hired and I give them the date for my initial hire, they kind of raise their eyebrows. And it's like, no, I took 40 years off to go to med school and have a career. So, but Hy-Vee, the health and wellness is the biggest department at Hy-Vee. So we've got our pharmacy that everyone knows about.
Mm-hmm.
In addition, we have Amber Specialty Pharmacy based out of Omaha. We'll talk about it a little bit later, a Red Box Pharmacy RX, our online pharmacy. We have a pharmacy benefit management company called Vivid Clear RX. And we recently started this last year, Hy-Vee Health Infusion Care in Des Moines and Chicago, soon to be other Midwest areas. And then also recently partnering with in Hy-Vee Health Exemplar Care, which is a direct primary care and urgent care practice, and starting soon to be dabbling in some health insurance. So there's a lot of healthcare activities going on in addition to with our dietitians and food as medicine. We're really looking to have a sort of a full suite of offerings on the health and wellness side for Hy-Vee. And so active in doing so, involved in all those areas. So there's plenty to keep me busy.
I would say it sounds like a ton of stuff going on. So again, I can imagine you are a very busy guy. Again, certainly more than just a grocery store nowadays with all the additional offerings that you guys have. So again, we're going to kind of drill down today on, again, the mental health side of things, because May is Mental Health Awareness Month. Again, right now I have on the screen punched up, it's the Substance Abuse and Mental Health Services Administration's website. You can find a link to this website in our YouTube live stream. If you're watching, again, on YouTube, or if you're watching on the 1011 platforms, you can find that link on our YouTube channel. But again, May, Mental Health Awareness Month. It's been that way since I think the late 1940s. But again, it's an issue that we need to talk about, because over the last few years, things have kind of gone downhill for a lot of people. What would you say, I guess, overall, is this kind of state of mental health in the country as it stands right now?
Yeah, so certainly right now, I think most the mental health field would view us as a crisis. The COVID-19 pandemic caused a significant amount of disruptions in all ages. Children, teens, adults have really been struggling to get back to normal. A recent study by the American Psychological Association pointed out two facts with adults. So 35 to 45-year age adults, from 48 to now 58%, a 10% increase, state that they have a chronic health condition. And specifically looking at just mental health, The youngest adults, those below 35, had a 50% increase in reported mental health diagnosis since 2019. So certainly, however you want to look at it, we're kind of in the middle of a mental health crisis.
Yeah, and I think again, certainly after the COVID pandemic, it was pretty easy to see again a lot of people just struggling to get through that, especially again the kids, young children and teens. Again, with some of the lockdowns that we had, missing school, some of the learning loss, kids and teens have been greatly affected over the past few years.
Yeah, it's hard because, a big part of school is not simply the content you learn, but all the socialization and isolating children by themselves and away from their peers. It's just not a good long-term strategy or short-term strategy for any of them.
Yeah, and so super important to again focus on the kids, and again focus on our young people, but also equally as important, and we don't want to leave them behind. Again, as a parent of two young children myself, it's important to take care of yourself and take care of the adults as well, because there are just as many adults as there are kids who are struggling out there nowadays.
Right. And, recently 1 in 5 adults have stated they've got a mental health diagnosis. And so that's a significant number. And, we realize at Hy-Vee it's more than medications. This is really going to take a holistic approach, and it's going to involve not only medication, but also looking at how you sleep, because if you don't sleep well at night, the next day is never good. Your nutrition, your diet, and finally being active during the day. So we developed a 4-part video campaign that we entitled A Holistic Approach to Mental Health, in which we make it available for our customers and patients, as a resource to help them with their struggles through mental health, and also having it available so that they can watch it wherever they're at, and not specifically need to go to a provider's office to get this content.
And you mentioned sleep in there. How important is a good night's sleep? I know they say anywhere between 7 and 10 hours is kind of what you should get, but how important is that for people?
Yeah, so our first video has Dr. John Vanderveer, the CEO and founder of Exemplar Care, going through the importance of sleep. And, it's sort of a double-edged sword when you don't sleep, because not only don't you sleep, but also you're not sleeping, which makes things all the more difficult. Our bodies really need that time to recharge and recover from the previous day. And as I mentioned, when you don't sleep well, the next day is difficult. And so we talk about some good sleep habits, some things that you can do to help maximize your sleep.
Yeah, I know. I was up late last night and up early this morning, and so I was a little bright-eyed and bushy-tailed this morning, but I'm a little bit more awake now. And so, what other tips do you have to be proactive for your mental health? Because it's not just a do this one thing and things are going to be okay. Like you kind of said, it's a multi-step process, and it's an ongoing active process that you kind of keep having to work at.
Sure. So the next thing, that I would point out is being physically active. And that's the second one of our videos with our fitness and wellness expert talking about the things you can do during the day to stay active. And so for many people, they view exercise as this big mountain that's just so difficult to overcome that they're not going to want to try. And, I really emphasize this isn't about going out and getting exercise, although that is helpful, but really it's about being active, getting up when you can, walking around the home, walking around outside. The most exercise you need for your health is really just getting out and walking. So trying to stay active. And even, we have a program, Kids Fit, where families and young kids can stay active together. And it's a great program that you can access also on our website.
So sleep is one. Just being active, moving around, some exercise is number 2. You said it was a 3-part or 4-part video series. What are parts 3 and 4 there?
Yeah, so the third one is a video with our nutrition team talking about really the benefits and also the challenges of diet on mental health. So there's a lot of great things you can eat to help with your mental health. And there's some things that are not so good. Sometimes people sort of self-medicate with food when they're not in a great mood, and that can be a challenge. So just going through some of the foods that actually can help you feel better, and then just some dietary options that you can incorporate, simple things to help improve your diet.
So we got sleep, we got exercise, diet, and then the fourth one.
It's really about medication. So it's understanding your medication, managing your medications. So we have one of our team members from pharmacy going through the importance of following the prescriptions, following the medication directions, understanding what you're taking, when to take it, what food that you may not want to take with the medicine. So it's really trying to go through and help people really understand this final part, and that's if your doctor chooses, then how you help manage your medication.
So a really layered approach. Again, with the sleep, staying active, the diet, and then if kind of those three things maybe aren't enough to get you over the top, and then you can kind of add the medications on top of it.
Yeah, because it's about your whole life, and I think that's why we use the term holistic, because it's very difficult to make a big change when you affect just one. So it really is truly a holistic approach to try and help you sleep better during the day. You're active, you've got a good diet, and again, if you needed, understanding and help managing your medication.
And so again, we already kind of touched on this a little bit at the beginning, but again, Hy-Vee, a lot of people think Hy-Vee, again, they think local grocery store, but in reality, you guys are much, much more than that now, especially with your efforts over the past several years. Again, going back to the COVID-19 pandemic, to be this holistic, grocery store and wellness center where folks can go get help with mental health and their physical health as well.
Yeah, because with mental health, we know one of the best options, telehealth. So telehealth doesn't work for all types of healthcare, but it works very well for mental health. And so Redbox RX is our online telehealth provider. Patients can go and have either synchronous, asynchronous video visit with a healthcare provider. They're licensed in all 50 states. It's discreet, it's private. If in conversations with the provider, the patients decide medication is the route they'd like to go, the medication is shipped discreetly to their home, and there can even be follow-up visits. And they don't, for some patients, getting dressed, getting in the car, going to a provider's office, sitting in a waiting room is just too much of a challenge and a hill to overcome. So having it from the convenience of wherever you happen to be, at home or on the road, through the computer, it's a good option for many people that are looking for mental health treatment.
And you just mentioned it. It can be the first step can often be the hardest to get help. I guess what's the reaction been? What have you kind of seen as you rolled this out to all the stores? What's the reaction you've seen from people who have been taking part in these programs?
Well, it's been great, and I tell you, it really, the Redbox RX option really serves a purpose for people that don't have a provider. Like I said, they just have a difficult time leaving the house for healthcare. So obviously, we have great relationships with mental health providers all over our Midwest footprint, and our pharmacists do a great job helping the customers with their medications and their medication questions.
And so, Dr. Fick, we've talked about a lot of stuff today, and you've mentioned it a couple times, but I just want to make sure we at least spend a minute on it. If someone's watching this either live or after the fact, what's kind of the first step, at least for the offerings that Hy-Vee has? What's the first step for them to kind of reach out to access some of these services that we've talked about?
Yeah, so we have them all on our website. And it's an easy way to access. It's kind of a long website link, and perhaps you can pop it up there, but it's Hy-Vee.com, healthnews/mental-health. So it's a option to look at the videos, and then there's also ability there to actually connect with our providers. And so, but Redbox RX is also It's on the Google. We have an app now. It's on the Google and iPhone app stores, and so you can connect. Download the app or go through the Redbox RX website. Both of them are very quick to line up appointments with providers.
And let's see how fast I can maybe do this. Okay, I think, yeah, we got it punched up right here. So this is I believe, the website where, again, you can go to access some of these services. So, again, I'll make sure to include the link to this website as well in the YouTube description of this video. But, again, you just mentioned it. Again, I see your name on here already, again, with several videos, again, talking about good night's sleep, staying active, diet, and things like that. So this is going to be a good first start for folks who are maybe looking to access some of these services. Dr. Fick, again, we've kind of unpacked a lot today. Is there anything else you want to make sure that we mention before we kind of let everyone go?
Yeah, just say if you are struggling with mental health, the hardest step's the first one. And there's, there are resources out there. There's people out there willing to help. And there's absolutely no reason you have to, suffer in silence or by yourself. There's people out there, and everyone are out there waiting and willing to be helpful.
Absolutely, and I echo that statement as well. Again, Dr. Fick, thank you so much for taking the time to join us today. We really appreciate your time. Again, we know you're a super busy guy.
You're welcome.
All right, again, that was Dr. Daniel Fick, the Chief Medical Officer with Hy-Vee. Again, going through, again, some of the services that Hy-Vee kind of has to offer. Again, important to know, for people to know that those are out there. Again, May is Mental Health Awareness Month. So, again, and like Dr. Fick said, sometimes the first step there can be the hardest. So hope anyone who potentially needs those, again, can reach out and kind of access those services. So appreciate everyone for tuning in and for joining us today. Really appreciate it. Hope everyone enjoys the rest of their Wednesday.